Assalamualaikum and hi everyone. My name is Muhammad Kanapi Abdulkani. Today I will talk about ICT in healthcare, which is focused on the telemedicine utilization to improve health services during pandemic. First of all, I would like to thanks to the host for inviting me to discuss and give a speech about the ICT in healthcare. However, I can't give a speech live today because uh, the schedule for this presentation is clash with my convocation ceremony. Okay, never mind. I try to give a very short uh, topic about the ICT in healthcare so that you all can uh, get the idea what is the ICT in healthcare and what the ICT healthcare all about, especially telemedicine. So if you want to know my detailed CV, so you can click to the HTTPS designer page. I work with UTeM as a professor, and currently I hold a post of CIO in the office of CIO of UTeM. So briefly, I would like to introduce myself. Is actually uh, before I joined as academia, I've been in the industry for a long time ago, for 17 years, involved in many projects, especially the software development project. Okay. So we go to the presentation agenda today. I will give some introduction, a brief telemedicine and its application, and finally the conclusion and discussion. So as an introduction, I will give you briefly about the ICT in healthcare. Before that, I would like to touch on the digitalization, and what is the digital transformation. So far, we are in the stage of digital transformation. So last a few years or a decade, so we in Malaysia we are busy with the digitalization, and we move to digitalization. Digitalization is a convert the analog information into digital representation, and then we digitize data, use digital technologies to improve and optimize and automate the process. And now the digital transformation era, where we align the entire population, we align the entire process to be digital. Yeah, everything use digital, no more manual or paper and so on. So with this era of digital transformation, there are a lot of industry, including the healthcare. So we need to uh, involve the healthcare in the digital transformation so that it will benefit to the citizen and also the patient as well. So ICT in healthcare. So I think you may be new in ICT in healthcare, or maybe you friendly very familiar with this word. Yeah, when you do or you deal with the banking transaction, so you deal with ATM machine, online money transfer, or internet banking. So same goes to the education. So ICT in education, we got ICT in government, ICT in oil and gas, ICT in plantation, insurance, investment, e-commerce. Nowadays, people go for shopping through internet, They are not going to the shopping physically. Uh, and then ICT in transportation. So we have Grab, for example, yeah, uh, what they call it, a lot of e-healing in Malaysia deal with the ICT. And finally, ICT in health, yeah, ICT in healthcare. So ICT in healthcare, especially in Malaysia, we are a step behind, yeah. So we don't have a central database or central electronic medical record for all hospital across the Malaysia to share the record. Yeah. So this is a problem, or we call it uh, we still behind from other country, especially in Europe or in UK and so on. Yeah. So all these involve software, hardware, telecommunication, and ICT related. When you talk about ICT, it should involve software, hardware, telecommunication, and ICT related. So when we talk about ICT in health, so this is a new area. Uh, for me, I think I already involved in telemedicine since 1997. So I look forward that ICT is very important in healthcare in order to help them to speed up the process of treating the patient, to do a referral, for example, referral letter, and so on. So without ICT, the accessing to the patient health record is very late. Yeah, it's very slow, and sometimes the repeating process is done in one hospital to another hospital. That's why ICT initiative across the world is already in the line, and Malaysia is also follow uh, the process of digitalization of the hospital. So I would like to introduce what is the telemedicine. Yeah, very simple. Telemedicine means the medical at a distance. So that means the medium uh, to enable the telemedicine is telecommunication, or we call it now is internet. So one uh, healthcare provider or doctor will communicate to the patient through the internet, yeah, or through the telecommunication, where the telemedicine some time ago, last time ago, they are using a telephone, yeah, to contact the or to speak with the doctor. But nowadays we got a very good telecommunication, and then we use uh, video conference to talk with the doctor. So the telemedicine uh, use a healthcare information exchange. So they use the information, and the information is shared with other healthcare specialists or healthcare provider. And telemedicine include the growing of variety of application and services using teleconference, voice, online chat, email, using computer and smartphone, and other form of telecommunication and media technology. So the telemedicine and evolution of medical services is a great. There are great difference, yeah, between the developing and developed worlds in terms of issues to do with health and healthcare services. So from the definition of telemedicine, medical at distance, uh, the emphasis on the developing world is on basic survival, such as providing better access to healthcare and increasing the quality of health. while in the developed world, the emphasis is on reducing public funding for healthcare. So the rapid increase in healthcare costs and finding way to control them have become the most important health policy issue for the developed world in the past few decades. But uh, in developing countries such as Malaysia, so we are not focusing on the effort to increase the healthcare cost. We try to improve the quality of cost. We still struggle in providing healthcare services with quality. But other developed country, they are focusing on the healthcare cost to reduce how to reduce the healthcare cost. So many factors contribute to the rapid rise of healthcare costs. Why the healthcare cost is increased? One is the demographic changes. Demographic changes mean the population aging is increased. Yeah? Chronic disease is increased, and disabling condition as well as changing disease pattern from communicable diseases to non-communicable disease. But nowadays we are suffer with COVID-19. Yeah, last time we are suffer with the lifestyle diseases, which is non-communicable diseases such as heart attack, depression, diabetes, high blood pressure, stroke, and etc. So this kind of diseases to maintain will incur a high cost, especially on the cancer, for example, heart problems, diabetic, stroke. So it will incur a lot of cost. So there are many ways to resolve this thing, especially in the developed country. They are looking for new technologies, to mitigate the healthcare cost for the country. So this is one of the telemedicine and evolution and the devolution of medical services. Why telemedicine is required? Because this factor, demographic changes, chronic diseases, changing diseases patterns, and lifestyle diseases. So telemedicine and the evolution of medical services due to new trend in diseases that are suffered globally, government and national health financing authorities seek new and different ways to provide adequate level of services at lower cost. So this is where telemedicine and telehealth initiative come into prominence, and studies have clearly demonstrated that telemedicine and telehealth initiative can realize saving while at the same time broadening the reach of healthcare system either during pandemic or not. So if we look at the past decade, so the diseases is come from the communicable diseases. They call it epidemic diseases, such as malaria, yeah, uh, SARS, and so on. Then before the COVID-19 come in 2019, yeah, so we suffer with lifestyle diseases, yeah, obesity, heart problem, diabetic, and so on, yeah. And this involve a lot of maintenance cost for the patient. And 2015 until now, we struggle with COVID-19. Yeah, although the COVID-19 reduced, but today the case increased to 4,000 plus and so on. So the pandemic actually attacked us, and at the same time, the lifestyle diseases is also increased. So now we face with two problems, yeah, pandemic and also the lifestyle diseases. So we need some technology to help the healthcare services and also help the citizen to mitigate this health problem. So with the rising of ICT empowered telemedicine, yeah, ICT empowers telemedicine. So when you look at the digital transformation, now we got a lot of innovation, car, uh, unmanned car, yeah, cloud data, mobile apps, wearables, devices, mobile devices, private robot, e-commerce, smart home, contactless pay, home robotic, yeah. So and now it's a industry 4.0, IR 4.0. So this is involve a lot of ICT. So with that ICT features, so it will empowers the telemedicine application compared to during my era in 1997. Telemedicine is not so interested by the healthcare provider or the government, and also the people, yeah, because we we complacent with uh, the face to face or physical consultation with the doctor, and then we don't have a problem like now with a pandemic COVID-19. So advances in ICT have heightened public awareness and health sophistication, thereby increasing demand for medical care. Yeah. So with ICT, there are a lot of application provide, or we can download from the mobile apps. Yeah. And then we can monitor our vital sign, especially when people got COVID-19, they have to monitor their blood pressure, for example, right? Their temperature, yeah, their oxygen, and also their condition of the uh, breathe, yeah, the breathe, and they have to communicate with the doctor or health or paramedic in the hospital, to take care about the COVID-19 status. So there are a lot of digitalizations transformation is empowered by the ICT. Yeah, that's why nowadays we can communicate easily with the friend to the other country, yeah, or we can find the doctor in other country and we can talk about the uh, problem or diseases that we face. Okay, this is telemedicine timeline. You can view or look at the timeline. So telemedicine connect any remote area with the telemedicine, uh, with the ICT empowerments, with ICT infrastructure and software. So the telecommunication can the doctor can communicate with the remote patient, through telemedicine application. So 4 decades ago, with demonstration of hospital extending care to patients in remote areas. So the use of telemedicine has spread rapidly and is now becoming integrated into ongoing operation of hospital. And some of the country, they are doing operation through video conference. Yeah. Uh, so the specialty department, home health agency, private physician office, as well as consumer home and workplace, they use the telemedicine to treat the patient or consult the patient. So what is the telemedicine services? And I will show one by one, yeah, the telemedicine services that improve the patient experience. So the most important thing of the telemedicine services is to improve the patient experience. What is the patient experience? especially on the convenience, yeah, less cost, yeah, and then they can choose the doctor who they like it or they comfortable, yeah. That is a patient experience. So one of the telemedicine services is primary care and specialist referral services. Yeah. So primary care and specialist referral services may involve a primary care or allied health professional providing a consultation with a specialist assisting and primary care physician in rendering a diagnosis. So primary care and specialist referral services uh, use a live interactive video, yeah, or they use the store and forward transmission of diagnostic images. So maybe a doctor in Malacca, they can contact to doctor in refer the patient to the hospital to the doctor in hospital Kuala Lumpur. Yeah. So our system, healthcare system in Malaysia is a pyramid system. Yeah. So any case or any visit to the healthcare services, they have to go to the primary care. So normally primary care is handled by the general practitioner, which is uh, no specialist. So when the patient got acute problem or they got a case, yeah. So the doctor in the primary care will refer the patient to the specialist hospital, for example, or secondary hospital. So this is a process. So for time being, they are referred through hard copy. Yeah. So the patient go to the hospital Kuala Lumpur. They have to uh, admitted in the hospital. They have to do a test. They have to do uh, imaging and so on. Same as what they done in previous hospital. So they will take a lot of time and cost actually. So another telemedicine services can be implemented is a remote patient monitoring. So for example, Tele-Home Care use devices to remotely collect and send data from home to a remote. Such application for the remote patient monitoring is to capture the vital sign, blood pressure, blood glucose, oxygen, and etc. Yeah. So this is one of the telemedicine services can be implemented to monitor the remote patient. Yeah. Another application telemedicine services is a consumer medical and health information. So this is information. Yeah, consumer medical and health information include the use of internet and wireless devices for consumer to obtain the specialized health information and online discussion group to provide peer-to-peer support. So normally they will contact with the doctor and doctor will speak to them, or they can communicate with the nurses or their friend who got same problem. So normally consumer medical and health information at the lay person level. So the person in charge we talk with the patient with a layman way. It's not an expert level. So they will explain if they got headache, so what they need to do. Yeah, what kind of medication they have to consume and so on. Example of consumer medical application is a smart card, yeah, through clinical email communication, online pharmacies, interactive health communication technologies, and also the health information literacy. So this is another telemedicine services for chronic patient who less mobile. So the telemedicine intervention can use uh, can help the chronic disease patient uh, through internet. Yeah. So the patient will communicate with the doctor, and then normally it provide continuous monitoring by their healthcare providers, identify early symptoms, and respond promptly to exacerbation in their illnesses. Another telemedicine services is a tele-home care. So tele-home care for elderly, underserved, homebound patient with chronic illness. So this is very important application during the pandemic of COVID-19. So in other countries, for example, in the developed country, the tele-home care is very, very helpful during the pandemic. So the patient vital sign is monitored through the internet. Yeah. So it allows home healthcare professional to monitor patient from a central station. Yeah. This is also normal done in Malaysia, but we don't have a tele-home care system. So they monitor the patient through telephone. So that also considered telemedicine. Yeah. So tele-home care virtual visit may lead to improve home healthcare quality and reduce cost. Yeah. And greatest patient satisfaction, increase access to healthcare providers, fewer patients needing transfer to higher or more costly level of care. Another telemedicine services is empower higher medical education. So this is a very specialized area where the healthcare professional can continue their education. For example, nurse they want to upgrade their position to matron or medical assistant to senior medical assistant. They have to sit the examination. So this is out of the our topic, which is regarding on the COVID-19, yeah, during pandemic. But this application will help healthcare professional to continue their career, yeah, all those in the pandemic uh, during the pandemic time. Yeah. So what is the telemedicine delivery mechanism? So telemedicine can be done through dedicated telecommunication network, which is link the dedicated network. We link a rural community and primary care health facility to tertiary or specialist hospital uh, using dedicated high-speed line. Yeah. So telemedicine also can be done through monitoring center link telemedicine. So let's say the authority will provide the healthcare services to home patients such as cardiac, diabetic, hypertension, elderly patient, home care, COVID-19, and etc. through the center link of telemedicine. Yeah. We have experience with the COVID-19. Kementerian Kesihatan Malaysia develop a lot of center link telemedicine they call it. So they monitor patient at home, yeah, on the COVID-19 progress. Yeah. So another mechanism is use a web-based e-health patient services site. So the patient can communicate with the health provider or healthcare professional through web-based application. So they can fill in the form online. Yeah. They can chat and they can contact the healthcare professional, either nurses or doctor, through web-based application. So what is the telemedicine benefit? So one is improved accessibility. Yeah, this is already done over 40 years. Yeah, telemedicine has been used to bring healthcare services to patients in distant location. Not only does telemedicine improve access to patients, but it also allows physicians and health facilities to expand their reach beyond their own office. Yeah, improve accessibility, either doctor to patient or patient to doctor. Yeah. We are so lucky in Malaysia because I think every 10 kilometer or every 5 kilometer we got healthcare provider, yeah, primary care services and so on. But if we compare to other country, the healthcare services is very difficult to get, yeah. So another benefit of telemedicine is cost effective. So reduce the cost of healthcare, reduce the cost of healthcare and increase efficiency through better management of chronic diseases. And it can shed the healthcare professional staffing, reduce travel time, and fewer or shorter hospital stays. So this is things that uh, developed country try to resolve the cost. I think if we implement the telemedicine or e-health in our country, the hospital stay I think can be resolved. Yeah, and the travel time, for example. Yeah, especially on the cardiology. Yeah, we only have I think 9 or 10 cardiology center in Malaysia. Yeah? For example, the Ipoh people have to come down to the to the hospital Sedang or IJN to get the treatment. So they don't have a center, or maybe they can go to the Penang. Yeah. So not every hospital in the state have a cardiology specialist hospital. So they have to travel to Kuala Lumpur, or let's say in south area, so they have to go to Johor Bahru hospital. Yeah. So if we got the telemedicine services, so the travel time, hospital stays, yeah, the consultation, the follow up case or process can be reduced, then it will affect the cost. Yeah, will reduce the cost, either the government and also the patient. Another benefit is improved quality of healthcare services. Studies have consistently shown that the quality of healthcare services delivered via telemedicine good those given in traditional in-person and consultation, because the process of consultation is same. The difference is physical to virtual using video conference. Okay, in some specialties, particularly in mental health, ICU care, COVID-19 quarantine and treatment, telemedicine delivers a superior product with greater outcome and patient satisfaction. So another benefit is increased consumer expectation. So consumer demand telemedicine services as it reduces travel time from home to hospital, patient stresses, and monetary matters. Yeah, if you go to the hospital Sedang in cardiology department, there are a lot of patients waiting from 7:30 a.m. until 4:30. Yeah, so it's very stresses, and they have to spend a lot of time in the hospital. Spend time for waiting to get the consultation. So if we got telemedicine, they just switch on the computer and communicate the computer to the Serdang hospital, for example, and talk to the doctor regarding their heart progresses, heart progress, their uh, status of the heart diseases. So they don't need to go to the hospital, commute to the hospital in Serdang from Tangkak, for example, from Johor or from Melaka to Serdang. It takes hours, it takes a lot of money, yeah, and so on. So in conclusion, in summary, healthcare ICT, especially telemedicine or telehealth, break the gap of inequality of healthcare accessibility. So that means if we use telemedicine, every single of netizen or citizen can communicate, can access to the healthcare services through video conference. So this will reduce a lot of cost, yeah, reduce a lot of time, yeah, either uh, citizen or also the government. So telemedicine could reduce government burden in managing healthcare costs for the citizen. Telemedicine escalate uneven resource distribution through online referral, second opinion via high-speed internet. So this is another problem, yeah. So you can see that during the COVID-19, we are shortage of doctors, we are shortage of nurses, we are shortage of healthcare professional, yeah, to handle the case for COVID-19, yeah, uh, and a lot of the medical officer during the COVID-19 is a temporary, is a contract staff. So this is time that government should adopt and should accept the telemedicine services, and they should embark this project seriously, yeah, seriously. So until now we don't have centralized EMR, yeah, so we don't have centralized ESR for Malaysian. So if government take this very serious on the ICT, healthcare ICT or telemedicine, I think all citizens in Malaysia uh, can get uh, healthcare accessibility uh, quite high, yeah, and we don't have a problem of cost and shortage of the medical officer. So lastly, telemedicine is a features of the future healthcare technology. That means uh, telemedicine can provide a good features to the healthcare services through the telecommunication technology, which can help, yeah, the government and also the citizen in delivering or in assessing the healthcare services in Malaysia, in healthcare provider, especially the Kementerian Kesihatan Malaysia. Yeah. Okay, I think that's it because I was given 20 minutes. Is actually. I hope you all in a short time you understand or get a view, get idea what is ICT in healthcare and actually what is the telemedicine. Okay, so ICT in healthcare is very big. So today I just bring one of the application in ICT in healthcare, which is telemedicine or teleconsultation. So with that, thank you very much. See you later. And if you have any question, so you can email me to kanapi@utem.edu.my. Okay, thank you very much all and assalamualaikum.